We'd like to show you the work we're doing here in Hillingdon, an area west of London, where we're bringing together hospital services, community care and GP services to form a partnership to provide more joined-up care for older people. Our new way of delivering more integrated care here is about quickly spotting people who are elderly and frail and who may be at particular risk of being admitted as an emergency to hospital. The Care Connection teams in Hillingdon are designed to work with the older person and their carers in their own home to try and prevent this happening. The key part of this work is developing a personalised care plan. We meet and talk to the older person and draw up a plan with their family and carers. This provides support both immediately and, ever more importantly, prepares them for what to do should the situation change. The idea is to organise the best possible care to enable people to stay in their own home.
The Care Connection teams comprise of a GP, the guided care nurse and the care coordinator. Really, it's health professionals coming together to provide joined-up care for the patients and to ensure that the patients have the best quality care they could possibly receive and also the best possible experience of using our services.
My main roles as a care coordinator, I'm looking at identifying new patients using data and tools. I'm looking at care planning them along with the guided care nurse, so we will go out and see patients, care plan them, and then I will be ongoing as a key contact to review their care plans and escalate them if needs be to the GP or guided care nurse. I think my favourite parts of the job are working as part of a team, so I get to work closely with the guided care nurse and the GP, and also being part of the patients' lives and supporting them on their ongoing journey.
Okay, so you've got the care plans, Amy?
Yep.
Eileen mentioned, I've discussed it with the GPs, what the podiatrist wanted, that Hillingdon. So I've prescribed that, but I think I've got to prescribe Brian, this more Cetraben, yeah. Okay. Well, initially I do a top-to-toe examination and obviously medication review. Get them to identify and understand their conditions. For example, with patients with chronic obstructive pulmonary disease, we would then discuss a care plan and actually prescribe antibiotics and steroids so they can manage and then can identify when they are feeling poorly, and they know then that their chest is a little bit worse than usual. We have use it a traffic light system on the care plan, and then they can commence their antibiotics or their steroids, contact myself, care coordinator, which frees up the GP day-to-day schedule that they have.
If we've got a query or any problem, I phone up Sue, and if it needs a doctor, then she'll get in touch for him to come down. Otherwise, she sees to us. She's very good.
Some of the patients have really quite complex issues, and very often as a GP, you're trying to deal with all those problems yourself without having any assistance or guidance. And now we have this regular discussion once a week, and we've got as many partners as possible in the room and the other members of the team. And we first of all discuss the patients who are on the guided care nurse's workload. We try and discuss them all, and obviously some quite complex issues for patients who've been unwell during the previous week. Patients are better looked after than they used to be.
I think we have a better understanding about what is available in the community, in particular what support there is for the patient and their carers on discharge. And we also know that when there is a problem, there is somebody that will contact us and speak directly to us or arrange for a referral to the Rapid Access Clinic so we can support somebody and prevent an unnecessary readmission or attendance at hospital. I think patients realise that they feel safer in the transition between different health professionals, and I think they feel that they're having to repeat their story less often, which is obviously a bonus for them, and they feel much more supported. So by providing phone call support as well as actually seeing people in Rapid Access Clinic, we can help prevent an unnecessary admission or attendance to hospital and actually support patient care better.
The fact that they can contact the guided care nurse straight away, and that guided care nurse is in the practice nearly every day as well and talks to us and asks our advice, and we ask them advice for how to look after the patients. And I've become very enthusiastic about the whole process because it's been so effective, and I really think this sort of thing should be done in every practice.
Having Sue and Amy there that we can call on is a great asset and is a peace of mind too.
Hillingdon's integrated partnership builds care around the needs of the patient. The Care Connection teams proactively join the dots together to make access to healthcare as easy as possible, ensuring patients get the specialist support they need in the community.